the, what are we doing?
Pelvic
Pelvic torsion technique. Just keep going. Now we're going to do the pelvic torsion technique. The pelvic torsion technique can be either a direct or indirect myofascial or a balanced ligamentous tension technique, depending on the way you use the forces throughout the pelvis. Initially, to set up this technique, what you're going to do is bring both hands to the ASIS bilaterally, and you're going to add a posterior and medial compression. The reason we do that posterior and medial compression is to gap the SI joints posteriorly. You can see what happens when I pull the ASISs medially. You can see how the SI joints gap. That creates the ability for this bony pelvis to be able to move and shift. Ultimately, our influence is trying to get at that pelvic basin and the myofascial tissues of the pelvic diaphragm. Now I'll show you how it looks on a person. Get the flat part of your hand, both sides, on the ASISs bilaterally. Add your posterior and your medial compression just until you feel the tissues engage and the SI joints start to distract. As soon as you start to feel that, put motion in through the pelvis, either indirectly or directly, and you can be putting in anterior, posterior torsions, medial and lateral flares, or compression or distraction, whatever you need to do to create balance within that basin. The way I know that I've hit the point of balance, or in the indirect or direct fashion, is that all of a sudden I can feel the patient's secondary respiration coming through the tissue. I actually feel him breathing in through the pelvis. That's not how I know I've hit balance. Once I've hit that spot, I ask my patient to take a few big, deep breaths all the way down from your belly. And as they do that, you can feel, let it go. You can feel the tissues start to unwind. If you're doing this as a myofascial technique, you would follow that unwinding, helping and assisting that tissue to release. If you're doing this as a balance technique, hold your position and follow the balance, follow the feel of the breath going through the tissue. And then as soon as it's done, just recheck your findings.